Hello and welcome to Live Healthy, Live Well, West Virginia. I'm your host, Dr. Lisa Costello, a pediatric hospitalist and assistant professor of pediatrics at the West Virginia University School of Medicine. 3 years ago this month, I became the host of Live Healthy, Live Well, West Virginia. Having the opportunity to host this show is a true privilege. With this show, we try to highlight activities, information, and resources available in the Mountain State to help people live a healthy lifestyle. I hope you have been able to gain information that helps you live healthy and well. This show has had many expert guests who cover a variety of topics. We also have a great team here that works to bring you this and other shows on the network. I'm very grateful for all of their work. For today's show, I thought we could take a look back on some of our past shows. You can find shows on the Library Television Network, YouTube channel, or website. So let's take a look back at my first show as host with our former host, Danny Scalise, to discuss public health. Danny is now the executive director of the Burke County Health Department in North Carolina. Strong public health infrastructure is vital for communities and people to live healthy and be well. Let's listen to Danny share about the importance of public health. Talk to me about what does public health mean?
So public health is a group of disciplines that include things like epidemiology, biostatistics, health policy, and we focus solely on the public's health. So issues that are broad-ranging and things that maybe you can't learn in the clinical setting or you can't help with in the clinical setting. So that's what you see with a lot of health departments, places like the CDC, things like that.
So, I think we talk about public health or healthcare. Isn't going to the doctor once a year, isn't that enough when we're talking about health or public health?
Well, first off, it's not enough going to the doctor once a year. You have to listen to what your physician says, and you have to have a good relationship with your primary care physician or any specialist you deal with. But what we've known, and the model from Robert Wood Johnson shows, is that only about 20% of your health outcomes come from clinical care. So everything else comes from things that public health deals with. So your living issue can affect your health. A lot of times the zip code you're born into because of things like environmental factors. So when you look at the issues that can affect your health, just going to the doctor doesn't. So you have to first off listen to what the physician says, and then second off you have to look at your lifestyle and all the things around it. Some of it's genetic, but a large portion of it is environmental factors and things like that.
And as you described with public health, it's really multiple disciplines. So really, it is a system. So how does the U.S. compare to other countries when we're really talking about public health?
So that's a broad question, and there's so many things that can be part of that. The U.S. has a much bigger system because we're a bigger country with a lot more wealth. So our system is built on the foundational, or the boots on the ground, are people like me, the public health departments. So everybody knows the public health department in their county. That's who they go to. That's who they see. They drive by the office. They see them on television. But there's also a state health department in every state and territory in this country, and they do a lot of things, including funding the local health departments. And then, of course, you have the CDC, Centers for Disease Control, and some other federal agencies that assist in things like funding as well as other interventions. And so our public health system is fairly robust compared to, but we're also a very big country. So we have a lot more than, say, third world countries, but we could probably do a lot more.
Well, we're thankful for Danny for sharing and for hosting this show for many years. Next, let's go back to our 2021 show when Dr. Elizabeth Sharman, the Executive Clinical Director of the West Virginia Poison Center, joined us to talk about the Poison Center. Here she is telling us about what poison centers do and how they help communities. Let's talk about what is a poison center and why is it important to have one in our state?
So a poison center is a location where healthcare professionals, physicians, nurses, and pharmacists that have special training in the management of poisonings join together as an organization to serve their entire state or their entire region. So poisonings are not rare by any means, but they're not as common as sprained ankles or sore throats or things that healthcare practitioners get trained on in school. So here is a group of people that do nothing but that topic, so that we always have the most up-to-date information on poisonings and poisoning managements for the state.
Absolutely. Does every state have one? Does every state have a poison center?
So what I can tell you is that every state and territory of the United States is covered by a certified regional poison center. So for West Virginia, we cover the entire state. Very small states like Alaska that can't afford to have a center for their entire state use another state to cover their services. So everybody is covered, and West Virginia is lucky to have one in our state.
Excellent. So no matter where you live, you as a health professional or the public, as we'll talk more, can have access to reaching the Poison Center. Well, tell us a little bit more about the West Virginia Poison Center here. As you said, we're lucky in West Virginia to have one poison center that really covers all of our state.
Yes, so we are located at the West Virginia University Charleston Division. So even though we're part of West Virginia University, we serve the entire state equally. So we serve from, I always say, from fetus to grave, because we get people calling about medications or things they might have gotten into while they're pregnant. And sometimes we collaborate with the medical examiner's office if there's been a death and there's some questions there. We cover all citizens in West Virginia. We even try to triage pets if we can. We handle all poisonings 24 hours a day, 365 days a year.
Another talented pharmacist we've had on this show a couple of times is Dr. Krista Capehart. Dr. Capehart is a clinical professor in the Department of Clinical Pharmacy and director of the Wigner Institute for Advanced Pharmacy Practice, Education, and Research at the West Virginia University School of Pharmacy. She is also the Director of Professional and Regulatory Affairs at the West Virginia Board of Pharmacy. Let's look back when she joined us to discuss medication safety tips. But what are some common questions that pharmacists tend to get in the, let's say the community setting?
So common questions in the community setting that often come up will be especially evaluation of those over-the-counter mild situations, really to say, do you think I can treat this with something that's available over the counter, or do perhaps I need to get an evaluation? And often, what would be the best thing to use over the counter? So maybe it is that rash. Maybe it is, my child, I need something to treat a fever. I have this cough and cold situation. And oftentimes people tend to think that because medications are available over the counter that, that they're safe and you don't need to worry about it. And that's generally true, but they are medications and they do interact with the prescription medications that we take. And so it's always important when you take an over-the-counter medication that's available without a prescription that you check with your pharmacist or your physician to make sure it's not going to interact with something that you're already taking. And that's the same with herbals and dietary supplements as well.
Thank you to Dr. Capehart and all the pharmacists out there doing important work to help people stay healthy and be well. Next, let's hear from Sherry Wright, a registered dietitian with the West Virginia National Guard, who joined us to talk about nutrition. Let's look back at her sharing tips about how to stay healthy when it comes to nutrition. If you're going to, give our viewers some basics of what would you describe or talk about nutrition generally?
So it's basically how your body utilizes nutrients. That's essentially what nutrition is, how your body utilizes food for energy. And there's optimal energy and then there's not so optimal energy. So if you're looking to focus on like a more healthy aspect of that, then that would be more like whole foods instead of like the ultra processed food, stuff like that. So, but basically it's how your body utilizes all of the things that you consume to produce energy.
Yeah, I think that's a great, when I try to talk with patients about it, food is medicine. I think a lot of times people don't realize that, it's challenging when we're trying to remember, because our body needs fuel, if you will, or energy to do all of its processes. So being healthy in general, or your overall health, really nutrition plays into it, like you were saying, before you're born to all the way, till the end of your life. So I think that's really important. So talk to us a little bit about what are some of the common questions you receive as a dietitian?
I get a lot of, how do I be healthy? Like, tell me how to be healthy. That's probably the number one question I get. I need to be healthy. What do I do? How do I gain weight? I get that one a lot. That one's kind of pretty common. And then what the heck do I feed my kid? That one's pretty regular as well. But those are probably the top questions I get, because I think when you have no idea where to start, the internet is probably the place everybody goes to. And it is broad, and you don't always get necessarily the best idea of the things that you should do. So I feel like that those are probably the main questions. How am I healthy? What do I do?
Right. And certainly there are many different resources out there, probably some more credible than others, and I'm sure we'll share some of those. But I'll kick off with some questions, because you talked about kind of energy that our body needs. And so I think, we think of there's different types of, or different ways that our body can get energy from different, sources. So protein, carbohydrates, fat. So what would you say are some good sources of protein that someone, when they're looking for in their diet, how they can integrate into some of those?
So I'm a big fan of bang for your buck. So I like protein sources that do more than just one thing. So I like more veggie protein sources. So things like beans, like that would be an excellent, everybody always thinks of that, well, that's like a carbohydrate. Yeah, it is, but you can get protein from that as well. And then you're also getting fiber, vitamins, minerals on top of that. And then filling in the gaps with the other stuff. So if you're eating like beans, lentils, like tempeh, tofu, stuff like that, you're getting like good bacteria for your gut, as well as excellent fiber and, like I said, the vitamins and minerals. And then if you're consuming some seafood or chicken or turkey or something like that on top of that. So I always like to think of it in like layering, like in bowls. Like instead of just having like a chicken, broccoli, rice meal, then I think of it like, okay, so I could add quinoa, and that would be some excellent protein. That would be some fiber. I could add some greens to this mix, maybe some nuts and seeds, and then I'm like layering all of my nutrients on top of that. And then I can add some like fish or chicken or something like that to it, and then it helps me get full, and I'm covering all my bases. So I kind of emphasize it like that, and then fill in the gaps with everything else.
Nutrition is really important for all aspects of our life, including in regards to maintaining a healthy weight. So our next guest that we'll hear from is Dr. Laura Davidson, professor in the Department of Internal Medicine and the director of Medical Weight Management at the West Virginia University School of Medicine. She joined us to discuss medical weight management. Listen as she talks about the importance of preventing obesity. So why is it important to kind of address this, and if we can, prevent it, prevent obesity as a disease?
Yeah. So we know that prevention is really the best option. It is in most things in medicine, but with obesity, it's certainly the same situation. I think anyone who has ever tried to lose weight, and I think most people have experienced this at some point in their life, because the studies are showing that really about a fourth of the population is at what's considered a normal weight. Everyone else as an adult is really overweight or has obesity. So I think most people have experienced trying to lose weight, and they have seen how hard it is. It's really, really challenging. And so if we can prevent that from happening in the first place, we're much better off, because our body is really made to try to maintain weight. If you think about many, many, many years ago, there wasn't enough food. So our bodies were designed to try to maintain weight so that we wouldn't starve to death. Well, of course, we all know this isn't the situation anymore. We're surrounded by food. And so we only have that drive to maintain weight. We don't have a similar drive with regulatory mechanisms to drive the weight back down. And now we're dealing with more the health problems from the excess weight. So if you do gain weight and then try to lose it, your body fights you in those efforts. Unfortunately, your body will sense weight loss, and these hormonal signals will kick in to increase hunger, increase cravings, decrease your movement, and your metabolism will slow. And all of these things make it very challenging for people to lose weight and keep it off successfully. And so that's why prevention really is the key whenever possible. However, we have ways of treating it once it has occurred. There are a lot of new things out there now that we can do, but certainly I think prevention is the key, because that will prevent all of these complications related to obesity. And I think we all recognize most of them. There's diabetes, high blood pressure, heart disease, sleep apnea is related. Lately, we've been seeing a lot more of what we call fatty liver, when fat accumulates in the liver and can cause serious liver problems. Of course, excess weight can lead to stress on the joints and osteoarthritis. And there are even several cancers associated with obesity now. So there's really a lot of reasons to try to prevent this.
Moving on to a different topic, Dr. Kara Pachowski, a clinical pharmacist and medical student at the Marshall University School of Medicine, joined us twice to share tips about tobacco cessation. Dr. Pachowski shared many helpful pointers, and I encourage our viewers to watch both of these episodes to learn more. Here is a clip of her discussing the first step in choosing to stop using tobacco. So remind our viewers about the work that you've done and continue to do when it comes to tobacco cessation.
Yeah, sure. Thanks, Dr. Costello. A little bit of background about me. I am a certified tobacco treatment specialist, and I was a pharmacist for years before I went back to medical school, which is what I'm doing now at Marshall. But before I went back to school, I taught a tobacco cessation group class for many years, did a number of one-on-one counseling sessions for tobacco cessation, and had the opportunity to create a online website called tobaccofreeme.org, where people can go for free to access resources to help them quit. So tobacco cessation is a huge passion of mine.
And it's so important, and certainly encourage people to check out the website and view our last episode, because we covered a lot about the impact tobacco and the substances with tobacco, how they impact our body, and why it's really important to quit. So let's kind of dive back in talking about that. And I think it's important to remember and remind our viewers of what's the first thing that someone should do, or what's the first step to quitting?
Yeah, absolutely. So that's a great question, and sometimes the hardest hurdle to get over. But I think as long as you even have it in the back of your mind that you're ready to quit, now's the time to be thinking about it. And step one, that's probably the most important, is to set a quit date. So there's actually some data to show that if you set a formal quit date, usually a couple days, even weeks in advance, so you have time to plan for it, that's more successful than trying to taper down slowly or decrease the amount of tobacco that you use every day. It doesn't usually work that well when you try to go that way. It's best to pick a date, and that's the end. So I suggest, even if you kind of are thinking about it in the back of your mind right now, or you know someone who wants to quit tobacco, or you want to encourage them to quit tobacco, encourage them to pick a quit date. Start to tell people that you know, so that everybody in your support system gets on board and ready for the quit date. But also pick it a little bit in advance so that you have time to do the things that you need to do in order to successfully quit, which we'll talk about a number of those things on this session. But just to start thinking about, I want to get rid of all my tobacco products by then. I want to make sure I have medications on hand if I'm going to use those. I want to have all the tools that I need to drop the habit of quitting. And so if you give yourself some time to think about it, to tell people, to prepare, it becomes more successful.
If you want to learn more about quitting tobacco, visit tobaccofreeme.org. Next, let's have Dr. Kevin Jenkins, who recently joined to talk about behavioral and mental health. Dr. Jenkins serves as the Chief Medical Officer, Behavioral Health Community Care, West Virginia. He is board certified in general psychiatry and child and adolescent psychiatry. After completing his training, he joined Community Care of West Virginia to assist in development of a behavioral health program to complement existing community care services. He shared lots of important information. Let's look back as he shared about why we should prioritize behavioral mental health to live well.
Thank you.
So let's kind of jump right in and kind of talk to us about why behavioral health is so important. I think a lot of times we might use behavioral health and mental health interchangeably, so maybe kind of talk about why we really need to be talking about behavioral health when we're talking about living healthy lives.
Absolutely. So you're right. We do use those terms interchangeably, and I'll do that today. So behavioral health and mental health, have similar connotations, but our mental health is often an overlooked or unaddressed part of healthcare, and that happens for various reasons, such as busy schedules, stigma, lack of resources, reluctance to discuss one's mental health, or really a lack of understanding of the importance of good mental health. It's especially important here in West Virginia. Pre-COVID data suggested that about 26%, so over 1/4 of West Virginians were depressed. Now, we all know that during COVID, those numbers shot up, so that number only increased during the COVID pandemic. We know that many of these West Virginians will not seek treatment for their mental health conditions, and some studies cite that as many as over half of people with clinical depression do not seek treatment. This is really unfortunate because we know that undiagnosed or untreated or even undertreated mental health conditions can lead to other mental health conditions, but also physical health conditions like heart disease, diabetes, high blood pressure.
Yeah, and I think that's so important and kind of, you kind of started there, but really, I do think sometimes there's a lot of stigma, and we've had other guests talk about stigma with certain diseases, and certainly when we talk about behavioral health or mental health, a lot of times there's stigma associated with that. However, really, our mental health, kind of our behavioral health impacts our everyday life. Can you kind of share a little bit more about what you were talking about, how, our mental health contributes to really things that we do every single day?
Yes, we don't realize the impact that our mental health has on our everyday lives until we really start to think about it. So it really dictates almost everything in our lives. Every choice that we make is influenced by how we perceive things and our outlook on life. I'm sure that we can all relate when we've had a low mood or a stressful situation. We tend to think and act differently than we do when things are going great. Persons with poor mental health or mental health conditions have increased rates of missed school and work. Their work productivity is worse per capita, and they have problems with interpersonal relationships in the workplace, which can lead to loss of employment, hours being cut, or problems finding new employment, which leads to problems with finances, which can lead to issues with nutrition, housing, utilities, and even transportation, to name a few. So many mental health conditions really affect our interpersonal relationships. That can lead to things like loneliness and social isolation. And people with untreated mental health issues may find themselves turning to self-medicating with alcohol, marijuana, or other substances. This can lead to substance use issues, which also come with their own impacts on our lives. Many times there can be a cascading effect where we have depression or anxiety, and that leads to this certain circumstance and that certain circumstance, and one problem leads into another problem. So when we really start thinking about it, it's all about our perception of life. And someone who is depressed or anxious may perceive life differently and make different decisions than they would if they were doing mentally well.
For our next clip, let's go back when Bria McNown, a certified ISR instructor and owner of West Virginia ISR, joined us to discuss water safety. Drowning is a leading cause of death in childhood. According to the U.S. Centers for Disease Control and Prevention, drowning is the #1 cause of accidental death for infants and young children between the ages of 1 to 4. Drowning risks and prevention measures change as children grow, and at all ages, multiple layers of prevention are needed. Let's look back at some of the helpful tips Bria shared. So, how can someone make this be a priority, kind of every day, whether they're at home or in a place that there might be a larger body of water?
Of course, just like we talked about, thinking about water safety, what your water safety plan is, what your surroundings are. We really just need to take all of that into account. We need to have multiple layers of defense. First being supervision. There's no amount of skill that a child can have that is going to be better than, exceptional adult supervision. And we all, again, there's lapse in supervision every day at all times. It takes 30 seconds for your child to get out of your sight, whether that is in the bathtub, in the toilet, like you said, buckets of water, baby pools with a few inches of water. It only takes an inch for a child to drown in water. So we really just need to be thinking of all those things. Like I said, the first thing is supervision. Second thing would be quality swim lessons. And as children and infants go, that would be self-rescue swim lessons. And there's a big difference in just swim lessons and survival swim lessons. So those things are the top two things that we need to start thinking about first. And then, of course, fences and door alarms, things like that, that also are barriers of protection.
And I think that's such an important part, that really you want to have layers of protection. And the American Academy of Pediatrics and other child health advocacy groups, they have different resources available. And I think it's really important about that supervision piece, and that really you need to be rotating if you know that you're going to be in a situation, like say you go to the pool, making sure that people take turns in making sure that they're the designated supervisor, and having it very clear like who the supervisor is, so that there's supervision in addition to what skills a child may have. Because I've learned this firsthand. I mean, it's tiring for a little one when they're in the pool, even if they're having a good time. I mean, it can be pretty tiring. Would you agree?
Yes, and the other thing, I think we've spoke about this too, it's not necessarily the confidence that you have in your own kid, but when there's other kids in the pool and them wrestling and playing, you see it every day. Kids push kids under the water. They don't really understand the dangers of that, and they get excited. And there's a lot more than just like, oh, well, my kid can swim. And I love that you brought up the point of, having a designated person watching children. I think that's so important. We call them water watchers, that they put their phone down. They have nothing but eyes on the pool for their kids, and the kids in there, and switch out every 15 minutes so that you don't get distracted and so you don't get bored, because it's very easy to, turn your head and then you get distracted, and then here we are.
Well, thank you for joining us today, and for all of our guests over the past few years. I want to thank our team here as well for their work to bring this show to you. We look forward to future shows to help people lead healthy lives. Thank you for tuning in to Live Healthy, Live Well West Virginia on the Library Television Network.